Good morning, everyone, and welcome to the second meeting of the Committee on the Return of Individually Specific Research Results Generated in Research Laboratories. Real privilege to be in this beautiful facility, and my thanks to all of our colleagues at the National Academy of Sciences for all the work that went into this meeting. I've got an outstanding committee to begin with, but an outstanding list of guests who are going to participate with us today. Sorry to say a number of the guests have had trouble due to national weather circumstances, and so a few folks may be coming in late, others won't be able to make it, others will be participating with us over the web. Thought it might be helpful to just very quickly go around the table and ask the committee members to introduce themselves. So I'm Jeff Botkin at the University of Utah, a pediatrician, chief of the Division of Medical Ethics and Humanities, and the associate VP for research. And I've been involved in research ethics issues for a number of years. Great.
I'm Bray Patrick Lake. I serve as the Director of Stakeholder Engagement for the Duke Clinical Research Institute. I come from the patient advocacy background of being an individual patient advocate. I've also been the president of a patient advocacy foundation and gone on to work on larger frameworks to incorporate patient partnership into research design and conduct.
Hi, I'm Richard Fabsitz. I'm recently retired from the National Heart, Lung, and Blood Institute, where I served as the Deputy Chief of the Epidemiology Branch. I'm currently with the George Mason University Department of Global and Community Health.
Good morning. I'm Vanessa Northington Gamble. I'm University Professor of Medical Humanities at the George Washington University. I'm a historian of medicine, and also do work in bioethics.
Good morning, I'm Rhonda Cost. I'm an internist trained in translational science. I'm the Clinical Research Officer for Rockefeller University Center for Clinical and Translational Science. I do mixed methods research on patient preferences and validated outcomes for research process.
Morning, everybody. I'm Steve Jaffe. I'm Chief of the Division of Medical Ethics at the University of Pennsylvania Perelman School of Medicine, also Professor of Medical Ethics and Health Policy and Professor of Pediatrics. I have worked on issues of research ethics, human subjects protection, and other questions in bioethics, as well as ethical, legal, social issues in genetics and genomics for many years.
Hi, I'm Olivia Yost. I'm the research associate on this project with the National Academies.
Hi, I'm Emily Busta. I'm a staff officer with the Academies on this project.
Hi, I'm Chester Brown. I'm Division Chief of Genetics for the Department of Pediatrics at the University of Tennessee Health Sciences Center in Memphis, affiliated with Le Bonheur Children's Hospital and St. Jude Children's Research Hospital. We are building programs in genetics and genomics at the university, and I have both clinical and scientific roles in population genomics and in basic science interests in obesity and diabetes.
Wiley Burke, University of Washington, Bioethics and Medical Genetics.
I'm Paul Applebaum. I'm a psychiatrist at Columbia University. I run a center on ethical, legal, and social issues in genetics, and similarly have been involved for a long time with research ethics issues more broadly.
Hi, I'm Greg Gonzalez. I'm an assistant professor in the Department of the Epidemiology of Microbial Diseases at Yale School of Public Health. I've also been a participant in a clinical trial. I lived with HIV for the past 25 years. Also work with and co-direct a group at Yale called the Collaboration for Research Integrity and Transparency, which is interested in data sharing and transparency in the clinical research enterprise.
Hi, I'm Sue Botkin. I'm a nurse and a biomedical informatician. My program of research involves returning research results, non-laboratory research results, but other type of research results to patients, and particularly for Latinos with varying levels of health literacy in the Washington Heights area of New York City.
Deborah Leonard. I'm Chair of Pathology and Laboratory Medicine at the University of Vermont Health Network and Director of their Genomic Medicine Program.
Hi, I'm Michelle Mancher. I'm the study director for this study.
And folks we are missing at this point include Amy McGuire, JD, PhD, who's the Leon Jaworski Professor of Biomedical Ethics at Baylor, and not here for obvious reasons.
I'm on the phone, Jeff.
Oh, good, Amy. Well, then go ahead and introduce yourself then.
Okay, sorry I can't be there in person. I was really sad to miss it. But I'll be on the phone for the next 2 days. And I'm Amy McGuire. I am the director of the Center for Medical Ethics and Health Policy at Baylor College of Medicine, and I do a lot of work around return of results in genetics and genomics research.
Thanks, Amy. And you came through okay, but a little louder whenever you have an opportunity would be helpful for us. Jim Nichols, are you on the line? James Nichols, PhD, is Professor of Pathology, Microbiology, and Immunology and Medical Director of the Clinical Chemistry and Point of Care Testing at Vanderbilt. And Consuelo Wilkins. Consuelo, are you on the line? She had last-minute travel issues. She's a physician, Executive Director of the Meharry Vanderbilt Alliance, and Associate Professor of Medicine also at Vanderbilt. Oh, and my apologies, Brian also, Brian Zickman Fisher, PhD, who's an associate professor at the University of Michigan. Brian, are you with us? All right. So I have a somewhat long statement here that I'm going to go ahead and read to give us some background about the committee process and frame some of these issues. So this is an open on-the-record information gathering session for the next day and a half. As part of the process, the committee collects information and materials to consider and discuss as it makes its findings, conclusions, and recommendations. Everybody needs to be mindful of the fact that the committee has no conclusions about anything at this point. We're still very early in our process. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the National Academies of Science, Engineering, and Medicine. Committee members typically ask probing questions, and in these information gathering sessions, it may not necessarily be indicative of their personal views, and certainly not indicative of any committee consensus views at this point. So the task being undertaken by the committee is to develop a report with recommendations that will inform guidelines and best practices for the return of individual specific research results generated in research laboratories. One of the distributed handouts contains an abbreviated statement of task for the study, as well as the committee roster. For those of you not familiar with the process, this is the second of 5 planned meetings. The committee will meet several more times in 2017, including an additional public comment session in October. Before the draft report's released, it will go through a rigorous review by experts who are anonymous to the committee, and the committee must respond to this review with appropriate revisions that adequately satisfy the Academy's Report Review Committee and the chair of the NRC before it's considered an NRC report. The expected report release is the summer of 2018. So the workshop's being held to assist the committee in addressing its statement of task. Panels will provide a venue for the committee to hear from research participants and individuals with relevant experience and expertise in research and clinical laboratory practice, and institutional policies, applicable laws, regulations, and communications. So as you can see, there's a lot of stakeholders interested in this issue that we've tried to pull together for this meeting today. Format of the workshop includes brief prepared remarks from the panelists, followed by opportunities for the committee discussion and Q&A with the panelists, and time permitting with the audience as well. Now, we ask speakers to keep their remarks to the allotted times and the committee moderators to keep sessions on time, with the goal of preserving time for a broad and rich discussion with each panel. And so just to emphasize there, we're going to give priority to the committee members who may want to ask for questions of the panel members, but if members of the general audience also have questions, then those will be welcome once the committee members have had an opportunity to speak. So at the end of tomorrow, there's a lot of time for public comments. In-person attendees can sign up to speak with Caroline Cilio, is that the correct pronunciation? Please limit the length of comments to 3 minutes. People who are listening via webcast can send in written comments to the committee through the system. The study is going to take place over the course of the year, and we're going to follow up with you for further clarification or details pertaining to your expertise. However, to help inform the committee's deliberations, we also welcome you to submit additional materials to the committee that pertain to your experience and return of results. So we've really given folks a pretty short period of time to speak to us today, but if you have additional comments you would like to submit to us, that's very much welcome. Sincerely appreciate time everybody's taken to participate in this workshop, and very much looking forward to the next day and a half. So Greg is going to be the moderator of the first session, and brief introductions of the panel at this point. More full bios are part of the written materials, and I'm going to turn it over to Greg at this point.